Alright guys, in trying to evaluate acute abdomen, there are so many things you actually be doing. That's basically to the patient, so that you can establish the diagnosis. You can, how will I put it? Yeah, establish the diagnosis. Then also things that will basically aid you in the treatment. So this is the aspect of past surgical history, because if somebody is complaining of stomach pain, which is acute abdomen, you can be suspecting that such a person maybe is a complication of a previous surgery that the person had. So for the past surgical history for acute abdomen, things you be taking note are this. We said that when clerking a patient with acute abdomen, all right, so it's actually very important so that you take a detailed past surgical history. All right, this is essential, so you can offer critical clues, all right, to why, or maybe to a possible reason why the patient is having that stomach pain for that time. All right, so you use it to actually check out for underlying causes, and guide you, all right, also to diagnose and also to manage the patient. So why does it matter? Now, previous surgeries can alter the normal anatomy of the stomach, all right, like let me say adhesions after laparotomy. That's what could actually be giving stomach pains to the patient. Maybe there's increased risks of complications, like the patient has hernias at incision sites and all of that. All right, so some past surgical history can mask or mimic symptoms of new pathology. You understand? So key surgical histories to ask the patient about. So ask the patient if they have ever had any abdominal surgeries, like appendectomy, cholecystectomy, bowel resections. So have they ever had any of those surgeries? Now, by the side, they are now writing the possible complications that is giving the patient the stomach pain. Ask them about hernia repairs. Have you ever had hernias? Ask them about gastric surgeries. Have they ever had any gastric surgery? Gynecological surgeries, that's in females. All right. Okay, sorry. Okay. This was abdominal. So for gynecological surgeries in females, ask them if they have ever had C-sections, hysterectomy, tubal ligation. All right, so all of this could cause adhesions or maybe complicate ectopic pregnancy. So then for urological surgeries, ask them if they have ever had nephrectomy, ureteric stenting, prostate surgeries. So all of this could actually affect urinary tract anatomy and pain patterns. Then laparoscopic and open procedures. So laparoscopic surgeries may cause adhesions, all right, though less common. So tips for clerking is: ask about the type of surgery, ask about why they did the surgery, ask about when they did the surgery, ask about after the surgery, did they have any complications. So clarify if the patient has had multiple surgeries or just one. You understand? So consider if there were foreign materials left behind after the surgeries, like mesh, stents. All of this could actually be causing all the complications that the patient is having at the moment.